Welcome to Mastering the Side Effects of Top 200 Drugs. In this video, I like to break down the common side effects and also rare and serious side effects of top 200 drugs. And most board exams, pharmacotherapy questions are focused on the major side effects and also rare and serious side effects. Therefore, I am confident that this presentation of those breakdown of those techniques, how to memorize them, and how to apply them for the board exam questions and case scenarios will definitely help you in your exams preparation. Let's start. Here, I like to start off with FDA's classification of adverse drug reactions. According to FDA's classification, it is divided as very common side effects, which means over 10%, which is a 1 in 10, or common, which is 1 in 100, or about 1% side effects. Here, I will be discussing today on the common side effects and also additionally the rare, which is 1 in 1000. However, often is given as rare but serious, which means rare and serious mean that can be results into death or life-threatening hospitalization and or sometimes can be causing significant disabilities. So here let me start off with a side effects based on their therapeutic classes. Here these are compiled into the therapeutic classes starting from analgesic all the way to the osteoporosis class of drugs. So here I like to start with first analgesics. Among analgesics, most commonly used analgesics include opiates. Opiates are often associated with side effects such as gastrointestinal side effects, central nervous system side effects, and also respiratory depression on overdosages. So here opiates that includes opiates are morphine, codeine, hydrocodone, oxycodone, and fentanyl, and many more opiates. All those opiates, most of them have something common side effect, which is more than 1% of side effects include gastrointestinal side effects. Among gastrointestinal side effects, constipation is a common. And those constipation side effect remains till the person take those opiates. That means has no tolerance to it. So that's the reason that has to be managed by laxatives. Generally, stimulant laxatives such as senna or bisacodyl is used for managing those constipation side effects. Also, there are additional side effects include nausea, vomiting, and especially respiratory depression or difficulty in breathing often results due to the dose related. That means high dosages and high potency steroids, the opiates such as fentanyl, high dosages, or any other opiate high dosages can result into fatal respiratory depression side effect and could be deadly. So, other side effects include sweating and dizziness and headache and sedation as well. So, generally, after long term use or repeated use of opiate can result in tolerance can develop, which means it require higher dosages for the same analgesic effect or pain relieving effect that was done with the low dosages in the previously. So, that is what referred as tolerance, which is often repetitive use or longer time use of opiate can result into tolerance. So here is a question. Which of the following is a common side effect of oxycodone, brand OxyContin? A. Constipation. B. Increased appetite. C. Hypertension. D. Weight loss. The correct answer is constipation. Next, class are antihistamine drugs. Most antihistamines have a nervous system side effects, gastrointestinal, genitourinary, and ophthalmic side effects. So here antihistamines primarily first generation antihistamines such as diphenhydramine, chlorpheniramine, hydroxyzine, claritine, fexofenadine, levocetirizine are covered. From those, most of them have nervous system side effect. They are drowsy and can cause dizzy, which can result into lack of coordination. And also some of them can result cause dry mouth and also urinary retention. These three are coming from the anticholinergic side effect and also can cause blood vision. Next class is antihyperlipidemics. Mainly here statins, which is also known as HMG-CoA reductase inhibitors, that often associated with musculoskeletal side effects and gastrointestinal side effects. Statins HMG-CoA reductase, more than 1% side effects include. The statins are atorvastatin, rosuvastatin, simvastatin, pravastatin, and fluvastatin. And musculoskeletal side effects that include muscle pain, which is also known as myalgia. If that continues, that can result into serious condition called rhabdomyolysis. And commonly, gastrointestinal side effect happens when start of the therapy, which which include constipation or diarrhea, or can result into heartburn. And recently have shown references published with the increase the risk of hyperglycemia, I mean can increase blood glucose levels. However, using this medication has more beneficial effect than the side effect of hyperglycemia. Here is the question: which of the following drug can cause myopathy or rhabdomyolysis? A. Metformin, B. Atorvastatin, C. Lisinopril, D. Losartan. The correct answer is atorvastatin. Myopathy or rhabdomyolysis is a rare but serious side effect which involves muscle breakdown, and which is especially this can more commonly can happen when they are combined with other antihyperlipidemic drugs such as fibrates, niacin, or combination with azitamib increase the risk of muscle pains. Next class of drugs are antihypertensive drugs. Antihypertensive class drugs include angiotensin converting enzyme inhibitors, in short, ACE inhibitors, angiotensin receptor blockers, short ARBs, diuretics, beta blockers, and calcium and channel blockers, and alpha 1 adrenergic blockers. ACE inhibitors, such as angiotensin converting enzyme inhibitors, include lisinopril, enalapril, ramipril, benzapril, captopril, phenopril. So these are often associated with the persistent dry cough, and also in the beginning of those therapy can lower the hypertension blood pressure and can cause rash and headache, and especially can cause increase in the potassium levels in the blood, and that can be more concern if patient has a renal disease. And there's a black box warning for ACE inhibitor that is called angioedema. Angioedema is a rare but serious allergic reaction which can be life threatening, which can result into anaphylactic shock, which can be caused. Symptoms can include swelling on the face, lips, tongue, throat, and also in the around the eyes. Next, here is a question. Lisinopril, an ACE inhibitor, is known to cause which of the following adverse reaction? A. Constipation, B. Cough, C. High blood pressure, D. Increased urination. Correct answer is B. Cough. Next, angiotensin receptor blockers, short ARBs, that include losartan, valsartan, olmesartan, telmisartan, irbesartan, candesartan, and azulsartan. Here they associated with the low blood pressure or hypotension, especially initiation of the therapy, and then in the risk of hyperkalemia much higher in renal disease patient, and also can have side effect of headache. Like ACE inhibitor, these drugs also have a warning of angioedema, rare but potentially life-threatening condition. Here is the question: what is the rare but serious side effect of losartan? A. Cough. B. Angioedema. C. Constipation. D. High blood pressure. The correct answer is angioedema. Next, calcium ion channel blockers that include amlodipine, dipidipine, felodipine, necarodipine. And these are commonly have peripheral edema or pedal ankle edema side effect. I mean, there's a swelling in the legs can happen. And also facial flushing, that means skin can turn red. And then it also has a headache side effect, which is a classical side effects of vasodilators, such as swelling, which is edema, flushing, and headache. Here is a question. Amlodipine, a calcium ion channel blocker, is known to cause high blood pressure, B. Ankle edema, C. Frequent urination, low blood glucose. The correct answer is ankle edema. Next, beta blocker side effects that include here propranolol, metoprolol, carvedilol, nebivolol. This is a combination of cardioselective and non-selective beta blockers are included here. So they are often associated with the cardiovascular side effect. They cause bradycardia. That means they drop the heart rate. And also they can cause vascular disorders such as Raynaud phenomena because of vascular constriction. They are not used in patient with Raynaud phenomena. And also these drugs here, propranolol, metoprolol, and carvedilol, they can cross the blood-brain barrier because they are more lipid-soluble drugs, and they can cause mental depression and nightmares and vivid dream side effects. Here is a question. Which beta blocker is least likely to interfere with respiratory function in asthmatic patient? Correct answer is metoprolol. Metoprolol is a cardioselective beta blockers. So cardioselective beta blockers have a less side effect of those asthmatic patients. So therefore, that can be considered with the precaution. Next, thiazide diuretics that include hydrochlorothiazide, chlorthalidone, indapamide, metolazone, and chlorothiazide. Often they are associated with the blood side effects such as hypercalcemia, hyperchloremia, hypokalemia, hypomagnesemia, hyponatremia. And they also can cause hyperuricemia, which can cause acute gout attacks, metabolic alkalosis, blood glucose, and serum lipid levels. There's a mnemonic for thiazide that is called hypergluc. Hypergluc means G for glucose, L for lipids, U for uric acid, C for calcium. That can cause all hyper conditions. Here is a question. Hydrochlorothiazide, a commonly used thiazide diuretics, can cause which electrolyte imbalance? A. Answer is low potassium levels. B. Next, loop diuretic side effects that include Lasix, such as furosemide and bumetanide, that cause commonly serum calcium hypocalcemia, hypocholeremia, serum potassium lower, that means hypokalemia, hypomagnesemia, and hyponatremia. You could see here all hypos here. So, a common side effect of loop diuretics include what? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. High blood pressure. Correct answer is hypokalemia. Is alpha 1 adrenergic blocker side effects, which are more than 1%, includes hypotension, which is low blood pressure, which causes the dizziness. And generally, these are less common with alphazocine, sildenafil, and tamsulosin. However, more common with doxazocine, prazosin, and terazocines. And other side effects include intraoperative floppy iris syndrome, in short IFS, which is mainly associated with the tamsulosin. And then sexual dysfunction, which is common with sildenafil. A type of sexual dysfunction that happens with the sildenafil is ejaculation disorders. Here is a question. Which of the following is a common side effect of tamsulosin? A. Dizziness. B. Hypertension. C. increased heart rate, D. Hyperthermia. The correct answer is dizziness. Dizziness happens due to the suddenly fall down in blood pressure, and generally these side effects are often associated with the higher dosages or starting with the high dose. So therefore, all alpha blockers should start with the low dose. So start low and go slow. Next, antidepressants. Here I include SSRIs, SNRIs, serotonin modulators, and also tricyclic antidepressants. SSRIs are commonly associated with nausea, especially sertraline has a high nausea, diarrhea, and also insomnia. And SSRIs or serotonin reuptake inhibitors, they are causing stimulating effect that results into insomnia. And serotonins are widely distributed into the gastrointestinal tract, so therefore that causes the nausea and diarrhea side effect. Next, it can also result into sexual dysfunction, and then some drugs in the SSRI, such as citalopram, associated with the QT prolongation. All SSRI have the warning of increase in the suicidal risk because SSRIs or antidepressants they increase the energy or activities. As a result of that, that person can tendency to have suicidal risk. So that's a warning, a black box warning for SSRIs. Here is the question. Sertraline is an SSRI antidepressant may lead to the which of the side effects? A. Weight loss. B. Nausea. C. Angioedema. D. Shortness of breath. Correct answer is nausea. Nausea is a most common side effect of antidepressant, especially in the beginning of this therapy, that is the sertraline. Next question, which of the following side effect of escitalopram? A. Weight loss. B. QT prolongation. C. Dry mouth. D. Blood vision. Correct answer is QT prolongation. QT prolongation is common side effect of citalopram and also escitalopram. Next class of drugs are tricyclic antidepressants. The tricyclic antidepressants have additional side effects such as antihistaminic effect, that is causes sedation. Anticholinergic side effects can cause dry mouth, constipation, blurred vision, and urinary retention. And additionally, it can also cause orthostatic hypotension. And then these drugs, especially tricyclic antidepressants, are known to cause arrhythmia or proarrhythmic. Therefore, that's considered as cardiotoxic drugs. Next class is SNRI, serotonin norepinephrine reuptake inhibitors. They also include a serotonin effect in the gastrointestinal tract. Therefore, they can be causing nausea and sweating and can be stimulating insomnia. And additionally, they also affect through the norepinephrine. An increase in norepinephrine effect causes the increase in blood pressure and also dysrhythmias. And duloxetine and milnacipran also have an uncontrolled effect on glaucoma. Like SSRIs, SNRIs also have a risk of increased suicidal risk. Here is the question. Duloxetine brand is Cymbalta, a type of SNRI class of drug. Duloxetine can cause which of the rare but serious condition? A. Hepatotoxicity, that means liver toxicity, pancreatitis, C. Glaucoma, D. Aortic aneurysm. Correct answer is hepatotoxicity. Next class of drugs here are atypical antidepressants that include bupropion, mirtazapine, trazodone. Bupropion is associated with insomnia, dry mouth, seizure is a contraindication, and also it is contraindicated in someone who have anorexia nervosa and bulimia nervosa. And again, since it is a very stimulating drug and can be causing energy in the beginning of therapy, so therefore it has an increased suicidal risk as well. Next, what following side effects are less common with drug bupropion? A. Weight gain. B. Sexual dysfunction. C. Weight gain and sexual dysfunction. D. Dry mouth. The correct answer is weight gain and sexual dysfunction is less common with bupropion. That's the reason why it is preferred for those patients who have those two issues. Next, atypical is trazodone. Trazodone primarily known to have drowsy side effects. Therefore, it is also used to calm down or sundowning effect for patients. And because of its sedative side effect, it is used as a to insomnia treatment. Next, which of the following side effect is associated with the use of trazodone? A. Insomnia. B. Sedation. C. Increased appetite. D. Hypokalemia. Correct answer is B. Sedation. Next class of drugs are antibiotics. Amoxicillin have rash, a dermatologic reaction, and also associated with diarrhea and neurologic side effects. Sometimes it can cause headache as well. So using amoxicillin or antibiotic for long term can result into resistance of the antibiotics. Question: which adverse reaction is associated with the unnecessary use of amoxicillin? A. Anaphylactic reaction. B. Antibiotic resistance. C. Tendinitis. D. Sunburn. Correct answer is antibiotics resistance. Macrolide antibiotics that include clarithromycin, azithromycin, and erythromycin. They are commonly associated with the abdominal pain, nausea, and diarrhea side effect. Additionally, it can result into headache and somnolence. And also, they are well known for cardiovascular side effect, that is QT prolongation. So these three macrolide, azithromycin, clarithromycin, erythromycin are cautious required in patients with the heart conditions and also have reports of hepatotoxicity like jaundice. Next class of drugs are fluoroquinolones. Fluoroquinolones also have gastrointestinal side effect like taste changes, that is known as dysgeusia, and also it can cause headache and insomnia side effects and cardiovascular side effects such as QT prolongation associated with fluoroquinolone. Fluoroquinolone also have a serious black box warning that can be causing some cases it can cause peripheral neuropathy, tendinitis or tendon rupture and neuropsychiatric symptoms are associated with the fluoroquinolones. Fluoroquinolones include ciprofloxacin, levofloxacin, moxifloxacin. Here is a question about azithromycin. Azithromycin is an antibiotic that is often mild and transient in nature. Which of the following is a common side effect of azithromycin? A. Abdominal pain. B. Hypertension. C. Hypothyroidism. D. Hyperglycemia. The correct answer is abdominal pain. Next, anti-diabetic drugs that include insulin, which is commonly known to cause hypoglycemia side effect. Here also include biguanide, which is a metformin, sulfonylureas, GLP-1 analogs, and then DPP-4 inhibitors and SGLT2 inhibitors. Here is the insulin that include all types of insulin, that is rapid, regular, and long-acting insulin. All insulins have a one common side effect. It can drop the blood glucose level, that is known as hypoglycemia. And also injection site reaction. It can change the thickness of the skin that can result into lipodystrophy, which means thickening or changing in the texture of the skin can occur. So that's the reason it is recommended to change the injection site each time, administer the different site. of the injection sites. Here is the question. What is the most common adverse effect of insulin, that is glargine lantus? A. Hypoglycemia. B. Hyperglycemia. C. High blood pressure. D. Nausea and vomiting. The correct answer is hypoglycemia. All insulins have a hypoglycemia side effect. Next, metformin, which is also known as biguanide class of drug. Commonly, metformin associated with the gastrointestinal side effect in generally starts with the high dosages. In the beginning of the therapy, if you start with the high dose, it can result into gastrointestinal upset. Otherwise, long-term use can cause deficiency of B12. However, generally it happens after long-term use. And especially in the renal disease patient, have to be very cautious because it can also increase a rare but serious side effect that is known as lactic acidosis. Here is a question. What is the common side effect of antidiabetic medication, metformin? A. Cough. B. Gastrointestinal upset. C. Weight gain. D. Hyperglycemia. The correct answer is gastrointestinal upset. Next class of drug is sulfonylureas. Sulfonylureas include glycoside, glimepiride, glyburide, tolbutamide. Here is the most common side effect of sulfonylureas is hypoglycemia. And then it can cause weight gain and also a rare side effect that is known as syndrome of inappropriate secretion of antidiuretic hormone. Here is the question. What is the common adverse reaction of glipizide, that is a brand is glucotrol? A. Weight loss. B. Hypoglycemia. C. Hyperglycemia. D. Hyperuricemia. The correct answer is hypoglycemia. All sulfonylureas have a hypoglycemia. That's the reason why one should take this with the meals to avoid those hypoglycemic symptoms. Next class of drugs are SGLT2 inhibitors. They all SGLT2 inhibitors are end with the name called gliflozin, that is canagliflozin, dapagliflozin, empagliflozin, L2-gliflozin. A. The side effects include thirsty, so drink plenty of fluids or water, or it can increase the infections because they secrete the glucose from the urinary tract in the urine, so therefore there is increased risk of urinary tract infections, and also it can cause vaginal fungal infections such as vaginal candidiasis, and also has shown to have some lowering the weight, can decrease the weight. And there is a serious black box warning on ketoacidosis required to monitor symptoms of ketoacidosis such as excessive vomiting, etc. Next question is, canagliflozin, a SGLT2 inhibitor, what side effect likely associated? A. Weight gain. B. Vaginal candidiasis. C. Severe hypoglycemia. D. Lactic acidosis. The correct answer is vaginal candidiasis. Next, anti-inflammatory drugs such as non-steroidal anti-inflammatory drug NSAIDs are commonly associated with the gastrointestinal side effect and then cardiovascular side effects, renal side effects are commonly associated. Most commonly used NSAIDs include brufen, naproxen, and also diclofenac. Here, those drugs side effects include gastrointestinal bleeding, heartburn, indigestion, or sometimes can lead to the perforation and ulceration. In renal disease patient, it can significantly decrease the renal function, so it is contraindicated in patients who have a creatinine clearance less than 30. And some can cause allergic rash, which can cause skin rash or itching. And some cases also have shown to have a headache and drowsiness side effect. About the NSAIDs, there is a warning about risk of increase in myocardial infarction, stroke, and heart failure. Next question is, what is the major risk associated with long-term use of NSAIDs like brufen? A. Hypoglycemia. B. Gastrointestinal bleeding. C. Hyperthyroidism. B. Hypotension. Correct answer is gastrointestinal bleeding, which is a common side effect possible of the NSAIDs. Next, antipyretics, that is acetaminophen. Acetaminophen is a widely used drug and well tolerated. Rarely it can cause rash and also can cause nausea or some rash. However, the higher dosages, acetaminophen can cause hepatotoxicity. Therefore, the maximum daily dose of acetaminophen is maximum 4 grams a day. If higher dosages, long-term use can lead to the severe liver injury and generally have shown unintentional overdosages commonly associated with the acetaminophen. Here is a question. Overdose of acetaminophen, the brand Tylenol, cause A. Renal toxicity, B. Hepatotoxicity, C. Respiratory failure, D. Infections. The correct answer is liver injury or liver toxicity, also known as hepatotoxicity. Next, anti-seizure medications. In this anti-seizure medication, mainly here covered are gabapentin and pregabalins. The gabapentin and pregabalin, both of them are primarily have a nervous system side effects. They can increase the dizziness and somnolence, and they also have ataxia, nystagmus, and diplopia side effect. Here is the question: which of the following is a common side effect of gabapentin, that is brand Neurontin? A. Diarrhea. B. Drowsiness. C. High blood pressure. D. Tachycardia. The correct answer is drowsiness. Next, antiplatelet drugs that include low dose of acetyl salicylic acid, which is brand is aspirin, and then P2Y12 inhibitors. So here is the P2Y12 inhibitors that include clopidogrel, prasugrel, and ticagrelor. So most of them are associated with the bleeding disorders such as bruising and nosebleed. And the gastrointestinal side effects include can be causing abdominal pain or some cases can be gastrointestinal ulcers and also have shown to have a skin discard or rash possible side effects. Here is the question. Which of the following side effect is commonly associated with the use of clopidogrel? A. Dizziness, bruising and nosebleed, constipation, and shortness of breath. Correct answer is bruising and nosebleed. Next question is which of the following is a common side effect of low dose aspirin? A. Gastrointestinal irritation, B. Hypertension, C. Drowsiness, and D. Hyperkalemia. The correct answer is gastrointestinal irritation. That's the reason low dose aspirin is prepared as an enteric coated aspirin, enteric coated dosage form, which helps to reduce gastrointestinal irritation. The correct next topic is anticoagulants and anticoagulants, heparins, low molecular weight heparins, vitamin K antagonists, that is warfarin, thromboxane inhibitors such as dabigatran, factor 10A inhibitors such as apixaban and rivaroxaban. All anticoagulants have increased the risk of bleeding risk, such as can cause bruising, nosebleed, or major or severe bleeding may occur regardless of the location, which can be leading to life threatening or even fatal outcomes. Here is the question about anticoagulants. Bleeding is more likely to occur during the starting period with a higher dose, resulting in higher INR. Which drugs that is associated with that? A. Warfarin, B. Metformin, D. C. Hydrochlorothiazide, D. Insulin. The correct answer is warfarin. Warfarin can be associated with the bleeding and that can result into changes in the INR, which is a lab test for detecting the bleeding risk of warfarin. Next, anti-gout medications that include allopurinol. Allopurinol primarily associated with the hypersensitive reaction. Like here, the allopurinol hypersensitive syndrome include s- severe skin reactions, and that can result into Steven-Johnson syndrome or toxic epidermal necrolysis. Other side effects include gastrointestinal nausea and metallic taste, and also can cause hepatotoxicity. So here, allopurinol hypersensitive reaction is a major one, and allopurinol also associated with the genetic polymorphism with human leukocyte antigen. So therefore, having screening test for the human leukogen antitest can help to minimize the severe cutaneous reaction, means should be avoided of those who have a positive test for human leukocyte antigen, HLA genes. Test, if it is positive, the person have to avoid using allopurinol. Here is the question. Allopurinol is associated with severe skin adverse reaction that include what? A. Hepatic failure. B. Acute renal failure. C. Steven-Johnson syndrome. And D. Myocardial infarction. The correct answer is Steven-Johnson syndrome. Next, antipsychotic drugs. There are two generations, first generation and second generations are covered here. First generation antipsychotic, primarily haloperidol, are associated with the extrapyramidal symptom, which is in short known as EPS. And the dystonia, EPS include dystonia, akathisia, Parkinsonism, and tardive dyskinesia. Other side effects are include the risk of neuroleptic malignant syndrome, which is associated with the all antipsychotic drugs. That could be muscle rigidity, fever, high fever, and also high blood pressure can be a classical sign of neuroleptic. The drug have to be discontinued and patient have to be managed in emergencies for those neuroleptic malignant syndrome. The second generation antipsychotics include aripiprazole, risperidone, quetiapine, olanzapine, paliperidone, loracidone, brexpiprazole. Primarily, they are associated with nervous system side effects such as daytime drowsiness, and also second generation has a higher weight gain, and especially clozapine is associated with the severe neutropenia, that is agranulocytosis and cardiotoxicities. Here is the question. What antipsychotic drug is associated with severe neutropenia? A. Clozapine. B. Olanzapine. C. Quetiapine. D. Aripiprazole. The correct answer is clozapine. Next, anxiolytics, which is benzodiazepines. Most benzodiazepines have a nervous system side effects, like that here benzodiazepines include alprazolam, clonazepam, diazepam, lorazepam, metazolam, and temazepam. So nervous system side effects primarily they cause daytime drowsiness and dizziness. And there is an increase the risk of falls in elderly, and also it can cause muscle weakness and slow the reaction. And also long-term use or regular use of these benzodiazepine have a risk of dependency, which means psychological and physical dependency happens due to this one. That means patient can only feel better if they take this medication, or they can sleep better when they take this. So that is what patient has become dependent. Next, what is the common side effect of clonazepam, the brand Clonopin? A. Hypertension. B. Drowsiness. C. Rash. D. Tachycardia. Correct answer is drowsiness. Next, alprazolam, a benzodiazepine, long-term use can lead to A. Severe constipation. B. Dependency and withdrawal symptom. C. Hyperglycemia. D. Hypocalcemia. The correct answer is long-term can result into dependency and withdrawal symptom for all benzodiazepines. Next class of drug here are bronchodilators that include short-acting beta agonist, long-acting beta agonist, and also short-acting muscarinic antagonist and long-acting muscarinic antagonist. Those are all bronchodilators. So here short-acting bronchodilator, that is albuterol, also known as salbutamol. Commonly it is administered through the inhalation techniques. So inhalers can lead to the throat irritation. And also overdose, higher dosages of regular use or high dose of salbutamol can result into cardiovascular side effect, palpitation, tachycardia, and nervousness can be possible side effect. Here is a question. Excessive use of albuterol can cause correct answer is palpitation. Next, steroids. Corticosteroids comes in all dosage forms such as topical steroids, inhaled steroids, nasal steroids, ophthalmic and otic drops, and also comes in systemic, that means oral or injection dosage forms. These are the one of the widely used drugs. So each dosage form, such as topical, ophthalmic, inhale, have a differences in their side effect because of site of those actions of these drugs. Inhales are several of them, such as beclomethasone, budesonide, cyclosinide, fluticasone, and mometazones. And there are also several combinations they come, such as budesonide, 4-meterol fumarate dihydrate, which is a Symbicort brand name. So they often, since it is the inhalation dosage form, they often cause oral candidiasis, which is also known as oral thrush. The next one is they also can cause headache, and then they can do cause hoarseness or dysphonia, means change in the voice can happen. Sometimes it can be permanent or can be temporary. So therefore, to minimize those inhaled corticosteroid side effects, one have to do mouth rinse after inhalation techniques. Question. Common side effect of asthma medication fluticasone inhaler include what? A. Diarrhea. B. Oral thrush. C. Constipation. D. Weight loss. Correct answer is oral thrush. Next, oral steroids cause several long list of side effects that include skin conditions such as acne. It can cause gastrointestinal ulcers. It can cause hypertension. It can also can cause psychiatric symptoms such as depression, and also long-term use can result into osteoporosis, and then cataract and glaucoma is possible. And also it can result into Cushing syndrome, which is a sign of overdose of steroids, and also cause growth suppression, hyperglycemia, diabetes, and also they cause adrenal suppression. So therefore, these drugs have to be gradually tapered and should not be stopped suddenly to minimize those adrenal suppression. Next question is prednisone as steroid is used for its anti-inflammatory properties. What is the common adverse effect? A. Hypertension. B. Bradycardia. C. Weight loss. And D. Immunosuppression. Correct answer is immunosuppression because all the steroids such as prednisone, prednisolone, dexamethasone, all the steroids are often they work like immunosuppressant agent. Next, gastrointestinal drugs that include antacids, H2 receptor antagonists, and proton pump inhibitors. Here, starting with proton pump inhibitor that include omeprazole, esomeprazole, lansoprazole, pantoprazole, and rabiprazole. Have those gastrointestinal side effects such as diarrhea, headache. However, often that is known for long-term use can result into vitamin B12 deficiency, magnesium deficiency, also can result into hip fracture, which could be due to osteoporosis, and also C. difficile diarrhea or C. diff diarrhea is possible because of long-term use of proton pump inhibitors. So here is a question. Omeprazole brand Prilosec proton pump inhibitor long-term use can lead to which of the adverse effects? vitamin B12 deficiency, iron deficiency, increased fracture risk, and then all of the above. Correct answer is all of the above. Next, H2 receptor antagonists, they all have ranitidine, famotidine, cimetidine, nizatidine. They generally have a more well tolerated, less common side effects that include nervous system, headache is possible. Which of the following is a common side effect of ranitidine? A. Headache. B. Hypertension. C. Tachycardia. D. Polyuria. Correct answer is headache. Next, hormone drugs that include thyroid hormones, antithyroid drugs, and hormonal contraception. So, first question here is levothyroxine. Brand is Synthroid. It's a well tolerated drug. However, there's a rare side effects of sweating, insomnia, and gastrointestinal side effects such as diarrhea and weight loss, and can cause palpitation and tachycardia. These are all combined you can call hyperthyroid symptoms. These are all hyperthyroid symptoms. Next is what adverse reaction might occur with high dose of levothyroxine, Synthroid. A. Hypothyroidism. B. Hyperthyroidism. C. Low blood glucose. D. High blood glucose. The correct answer is hyperthyroidism. Overdose of levothyroxine, which is a thyroid hormone, can cause higher thyroid symptoms such as hyperthyroid symptoms. Next, drugs are ophthalmic drugs that include glaucoma therapy, ophthalmic antibiotics, and ophthalmic anti inflammatory drugs. Here is the prostaglandin analogs such as latanoprost, travoprost, and there is a combination of latanoprost and timolol combinations. So these drugs associated with the ophthalmic side effects such as eye pigmentation, which can cause darkening of iris or eye irritation and eye pain. And also it can cause eyelash changes such as eyelash changes could be lead to the increase in the length, thickness and pigmentation and number of eyelashes. And then there is a rare side effect that also include upper respiratory tract infection like flu-like symptoms. Next, what drug is associated with the eye pigmentation side effect? A. Latanoprost. B. Timolol. C. Brimonidine. D. Acetazolamide. Correct answer is latanoprost. Next, muscle relaxants. The classical example of muscle relaxant includes cyclobenzaprine, which is often associated with the dizziness and also can cause drowsy and can be causing dry mouth. Here is a question. Cyclobenzaprine is a muscle relaxant. Which of the following is a common side effect of cyclobenzaprine? A. Dizziness. B. Hypertension. C. Bradycardia. D. Hyperglycemia. Correct answer is dizziness. Next class of drugs include osteoporosis therapy that include biphosphonates and which commonly associated with the gastrointestinal side effect. That include alendronate, risedronate, ibandronate, and also zoledronic acid. Here, most of them include gastrointestinal side effects such as esophageal ulcers, abdominal pain, or it can be new or worsening of the heartburn. And also, it can cause muscle and bone pain or night leg cramps, especially in the extremities. It is commonly associated, and also can be cause rash side effect. Here is a question: what is the generic name for the brand drug called Fosamax? A. Risedronate, B. Alendronate, C. Atidronate, and D. Pomedronate. Correct answer is alendronate. Next class is stimulants, which causes the stimulation of nervous system, and they also have a cardiac disorder side effect, gastrointestinal side effect. That include amphetamines, methylphenidate, dextroamphetamine, and also cocaine for nasal surgery anesthesias. Commonly, they are stimulants, so therefore they do cause cardiac disorders, palpitation, chest pain, and then gastrointestinal loss of appetite, and nausea and abdominal pain. And also, loss of appetite can cause weight loss as well. And then nervous system side effects are common, that is insomnia and restlessness. Here is a question. What is a common side effect of Adderall, amphetamine, or dextroamphetamine salts? A. Weight gain. B. Insomnia. C. Sweating. And dark stools. The correct answer is insomnia. Alright, with this information, thank you for watching. Stay tuned for more videos and subscribe Pharmacy Prep channel and give a thumbs up. Thank you again.